Welcome to the special information series on breast cancer survival. This is the first course in a series by Just Medicine. This first course on breast cancer survival will consist of 3 chapters. For those who may be interested, this course segs into the next course, The Secrets of Breast Cancer Surgery and Survival. These courses with Just Medicine differ from others in 2 main ways. Firstly, information is delivered in short videos and very specific to breast cancer surgery. Comments regarding other forms of therapy which are essential for the holistic patient treatment will be made briefly where they apply to surgical treatment but not in detail. Secondly, references are provided at multiple points of the video for patients to note and do their own research verification and fact-check. Dr. Mona Tan believes that this is the best way to provide patient education, as giving general information about breast cancer treatment may not be sufficiently focused for a patient who has to make a specific decision on the type of operation which is right for her. In this series of videos, we will be covering the history of breast cancer surgery. As we progress in the session, it will be evident that this history is closely related to what we know of breast cancer survival. Since this is an educational course, and not intended to replace a full medical consultation, please refer to the appropriate specialist for an in-depth discussion and treatment planning for your particular circumstances. Dr. Tan would appreciate feedback so that she can improve on these education videos to help patients more effectively. As mentioned earlier, there will be 3 chapters on this topic with a bonus video on an in-depth review of what doctors term today as the landmark studies, which revolutionized and led to a paradigm shift in the surgical treatment of breast cancer. This will be done in a later session, but now, in this video, we will present the history of breast cancer surgery as it is recorded from 1898 to 1969. Knowing the history of breast cancer surgery is crucial to understanding how doctors view breast cancer survival. Prior to 1969, the only treatment available for breast cancer was a mastectomy. As you know, mastectomy is a surgical operation where a total breast removal is performed. Survival after mastectomy was first reported by a surgeon, Dr. Halsted, at the American Surgical Meeting in 1898. Of a total of 133 patients, 76 women were alive after 3 years, which can be rephrased as a 3-year survival of 57%. This does not mean that every woman who underwent a mastectomy at that time lived for 3 years. It merely reports that 57% of them in this study were alive at 3 years. Some likely went on to live longer than that. 52% of patients who participated in the study, that is 69 women, were disease-free at 3 years. In other words, doctors could find no evidence of cancer at that point 3 years after mastectomy. Incidentally, Dr. Halsted was credited as the first person who came up with the working definition of a successful cancer treatment as one that maintained a patient in a disease-free state for 5 years. We refer to this today as 5-year survival, and it is also presented as a percentage. There is good news. We have data that takes us to 20-year survival now. This will be discussed in the subsequent sessions, including the bonus video. From the time Dr. Halsted reported his technique of mastectomy and the survival results of his patients in 1898, mastectomy remained as the standard of care for women with breast cancer for more than 70 years. It is not surprising that it became entrenched in the surgical practice of the day. So much so that in a later video, we will discover what kind of strength and momentum this tradition had, which sadly did not benefit women with breast cancer. It was not until the mid-1960s that there was dissatisfaction brewing about the disfiguration that women had to suffer that resulted from the Halsted mastectomy. 1969 represented the dawn of a new era in the surgical treatment of breast cancer. Let us move to the next chapter to discover how the medical world stood on the cusp of a surgical revolution.